Action, there we go. Sound is good? All right. For any of the folks that are watching on the live stream today, we apologize for the delay. We were just working on some of the sounds. For our folks that are here in person, thank you for coming in person. This will be pretty quick. So this is our Mental Health Services Act follow-up session. This is not the hearing. The hearing won't be till the 20th. It'll be at 3 o'clock here, so you still have time. I'm going to start off with a couple of things that we always do when we do in-person meetings, and then I'll dive into a little bit about what the intent of the follow-up session is. Lisa will help share a little bit about some of the updates, and we'll go into that. But this should be fairly quick. Won't take up a lot of folks' time. Just starting off with our mission to the Fresno County Department of Behavioral Health. Our mission statement is that as the Fresno County Department of Behavioral Health, in partnership with our diverse communities, is dedicated to providing quality, culturally responsive behavioral health services to promote wellness and recovery of individuals and families in our community. We also do a land acknowledgement. I do want to make sure that people understand when we do the land acknowledgement, it really is important that you have an intention on that. So there's not a checklist to just, hey, let's just throw out the names. So it's really important to make sure that the names are pronounced correctly, and we really look at the reason why we're doing it, and it is to venerate the people who came here before us. So our land acknowledgement for the Fresno County Department of Behavioral Health is acknowledging that we are on the traditional territory of several nations, including the Yokuts, the Western Mono-Manachi, the Eastern Mono-Manachi, which is where Mono County gets its name from, in case anyone wanted to know, it's from the Mono peoples. The Nimu, which are part of the Northern Paiute peoples, the Ohlone, and the Salinan. If you actually Google any of these folks, these peoples, you'll actually be able to see where their original ancestral lands were, which were encompassed parts of what is now Fresno County, and then where they've also were forcibly removed at times to other parts. But we still want to make sure that we acknowledge those traditional homelands and the ancestral lands of our Native American communities and indigenous communities here in Fresno County. All right, so I'm going to do this real quick before I turn it over to Lisa. Just so that you guys know, I don't read from the slides. The slides are more just kind of to like talking points for me, but it's also help you guys kind of see where we're at in the conversations information. But unless someone needs me to, I can go into them, but I usually don't read them. But give you just a real update on what the follow-up sessions were. These are actually created to ensure that we have transparency in our system and our process so that we're letting people know what's going on. And a lot of times our plans can be hundreds of pages long, and so when you post them for 30-day public comment, people are like, that's hundreds of pages I have to read. What we found is this is a way for us to kind of provide almost like an executive summary, like, hey, this is what we heard during our community listening sessions. This is the data that we've collected. This is what's going to be in the plan that you can look at, and Lisa will go in a little bit more into those. This is not something that's required at all. It's something that Fresno County started to do about 5-6 years ago because the feedback we got from the community was, hey, at times these could be 300, 600 pages. How much time does it take to read through those? And so we thought providing a follow-up session allowed us to kind of summarize to where then you can decide, do I want to go look more at this, or like I'm going to take it at face value? But it also allowed us to explain to people what we heard. So when we're doing our actual 3-year MHSA plan versus the annual update, which is what this one is, during our 3-year plan, we're doing a ton of stakeholder groups and forums. So we anywhere have at times 16 to 20 community forums. We'll do hundreds of surveys. We'll do key informant interviews. We'll do a lot of those types of listening sessions. And so there's a lot of input people are providing us, and then we have to try to combine those and put it and figure out how that plays into a plan. And so part of our follow-up sessions is to be able to acknowledge, like, hey, you know what, I heard your feedback on that. We like that idea. You're going to see this as a new project. Or, hey, we heard that idea. We think it's a good idea, but here's why you're not going to see it in the plan because we don't have, it's not cost viable at this time, or whatever it may be. In this time, the situation was a little different, which I'll get to later. But as an annual update, we tend not to have a lot of drastic changes, and we don't have as many community forums. So there's just not a lot of input that we've got to give back. But this is to ensure that people know that we heard what we're thinking, what we're planning, and that way, if you don't get a chance to go through the hundreds of pages, you've got some idea. Additional steps, we're going to go through this. We're going to continue collecting feedback all the way till next Wednesday. Then we're going to hopefully finalize the plan, submit it to the state, and then start working on some of our other goals. But before I go any further, I'm going to turn this over to Lisa, and Lisa's going to give us kind of a breakdown of where to find all the information on the plan, so that it makes it a lot easier for people if they want to dive into it. Or if you do, you're like, I don't want to read all of it. I just want to read this particular section that you talked about.
Awesome, thank you. So our plan is about 180 pages. So I'm going to tell you a little quick reference on how to navigate that. And the page numbers that I may give you now could change slightly just because of feedback we received today, or at the end of the public comment period, we can make changes based on your guys' recommendations. So the plan starts out, oh my goodness, about the description of Fresno County, so demographics, our cultural humility work, and some work assessments. And then starting on page 7, you will find information about our community planning process. So you'll see the meetings, any interviews that we did with our stakeholders, and it'll also tell you the findings that we took away from those meetings. And then Ahmad will be going over some of the changes that are happening in this annual update, and that starts on page 15. You'll see all the changes that he's talking about, as well as notes to program changes and funding. And then we have it broken down by section, all the MHSA components. So you'll see community supports and services starting on page 19, prevention and early intervention on page 98, innovation on 129, so see they're really big sections. Workforce education and training on page 147, capital facilities and technological needs on page 152, and then the admin and any other fiscal information is on page 153. In each MHSA component, you will find the program sheets that have all the details on each program, as well as brief descriptions on those components of MHSA, as well as budgets and any other information pertaining to those categories. And then finally, there's the appendices, where you will find all the information on our community planning, such as flyers, how we did outreach and whatnot. And then after this public hearing, if there's any feedback from today or at the end of our public comment period, all of that will be added in the appendices at the end. And I'm turning it back over to you.
Thank you, Lisa, and great job of actually spelling out all of the programs and not using the acronyms for people, so that'll be really useful. This is part of the beauty of us doing this live stream. This will be also saved as a recording, so you can find it on Facebook or YouTube later on, so you can go back. What page was that on? You'll be able to go back and review it. Just a couple of things real quickly, like when Lisa talked about our community planning sessions. For our annual updates, we don't do 20. Like I said, we only do a few. This year, what happened before we did it, even start our community planning process, we had a kind of a community forum specifically discussing Prop 1. Prop 1 had been signed, was going to go into ballot, and there was a lot of questions. And so we had said, because of a lot of the uncertainties that would be with Prop 1, and I think as of early this morning, there still was not a final take on that one, that it would really limit and curtail our abilities to do planning, because we can't plan for something we don't know, so we would kind of keep more of a status quo, keeping things the way they are. So we did 2 community forums. We did one on October 30th. We did one on November 8th. Those were both in person. And then also on November 8th, we also did a live stream like this. And you can go back and find that one. So that one didn't have a lot of people watching it live, but over the months, people went and watched it a lot more. And so people were able to gather the information. So that's kind of the reason why we try to throw in at least one virtual one, because it gives people the opportunity to go see a recording of it later on if need be. The plan was posted February 16th for the 30-day public comment. As I said, our public hearing is not till March 20th, so it's next week, so we're giving a little over a month. You can give public comment here. You can submit Questions, well, I'll provide you with an email where you can still submit questions and comments during this time. You do not have to wait till the 30th. The 30th is where we'll take the last of it. And then all the public comment we receive, we'll actually type it up, and that'll be included in the back of the plan as documentation of both us hearing it and the responses. I'm going to jump into the next one and hopefully not. There we go. So the Mental Health Services Act annual update, like I said, usually we don't make a lot of changes. This year was even less changes than we normally do, and that was because of Prop 1, because there was going to be changes to potentially how the Mental Health Services Act, being renamed to Behavioral Services Act, the funding priorities would change, the populations, the focus would change. So it didn't make sense for us to make a lot of changes and then in a year or two have to make more. So we kind of wanted to keep things pretty much as they were until we found out what was happening, which wasn't going to be till early March. And we posted our plan prior, obviously February 16th, before the election. So Prop 1 has potentially some changes depending on what happens, whether it passes or not. There are some legislative changes. So there'll be some influences there that'll impact how we design our system and how we do services and programming. We're also looking at economic forecasts related to Mental Health Services Act funding, in that always our funds are, the revenues we receive are in arrears. So they're from the tax revenues from a couple of years back. So if you remember during the pandemic, there were a lot of tax breaks. There was delays in terms of people when they could file their taxings, extensions, things like that, which was a good thing. And then they got those caught up. But now as they're catching up, you're going to get a more solid number. And so they are anticipating less revenues. If you guys have watched any of the news, you saw the state has talked about, its economic forecast and it anticipating a large deficit. If they're doing that, that kind of will probably trickle down. So we're not going to be getting as much revenue. So anticipating that, we also didn't want to do a lot of programmatic stuff if the money is not going to be coming in. So another reason why we kind of went the status quo. We really want to focus on sustainability in two parts, which is if you see under the funding, sustainable funding. Without the funding, it's kind of hard to provide the services. And then capacity. We wanted to make sure like we're not growing our programs too big to where then they're not going to be able to work. So that was kind of the strategy for MHSA annual update, which is why there's not a really new services. The changes that we have made are more minor, and some of the changes have been strategic to now leverage things like payment reform and some of those other options to try to not rely as heavily on MHSA, Mental Health Services Act, based on potential changes that could be coming. Our goal, selfishly, was to get this plan done, get it approved, get it off our table, so that as the county, we have spending authority going into next fiscal year, we're good. And then really, at this point, we figure in the next few weeks, we'll be done with this plan. We'll be able to assess what impacts potentially Prop 1 may have. And then we can start looking at how that impacts our system. What does that mean? Start planning, working. So we really selfishly wanted to get this annual update done so there's not a lot of changes in it and figure out what's going to be. And so going into the new fiscal year, we can start thinking like, okay, what do those planning strategies need to look like? So that's why you might go like, wait, these guys are usually putting out 600-page plans. Why is this under 200 pages? It's just we're not doing a lot other than like ditto, kind of keep it as is. Key changes in the area of prevention and early intervention as of right now is we made no changes in terms of new programming under prevention and early intervention. And if anything, we've been trying to look at how we can reduce costs to free up some dollars, insulate, our services. So we shifted our perinatal program out of PEI, so the program still exists. Everyone's employed. Services are still being rendered. I think that program might be like at full capacity, but because it's a program that we could utilize billing, Medi-Cal billing, and other funding resources, we said, well, let's utilize those so we're not relying as heavily on the PEI funding. So that is a difference in the plan. The program didn't go away. It's just not being funded out of this plan. We made a modification in collaboration with the Fresno County Superintendent of Schools for a component of the All for Youth program. So they were doing prevention and early intervention. Under prevention, there's stigma reduction, there's different categories that go into that. And while they're very, very important, as we're looking at how do we leverage potentially tightening of funds, we had opted to focus on really doing the direct services and more of the support services. When I say support services, I don't mean support services for students, but administrative support for the schools, onboarding, training, things like that, to look at other ways that we can do that, and so that we were utilizing those limited funds more for direct services. Also with payment reform and also a new thing called CYBHI, which is Children and Youth Behavioral Health Initiative, if I got that acronym right, is also additional funding opportunities that are going to be available to schools that may be able to utilize to offset. So they may be able to do that work in the future with those other funds, again, freeing up potentially some of these limited funds. We reduced our behavioral health communication budget, so our communication team, for example, is helping with this live stream right now. We're not eliminating the work we're doing. We have just found ways to become more efficient in-house, so we were able to reduce a lot of the costs and just develop our own skills to produce and create a lot of our own content. Just becoming a little more media savvy, a little more marketing savvy, that we're able to do some of those things in-house. And then we're holding not all programs at the current levels. Again, we're not in a position to expand programs for the most part, being that we have the uncertainty of what may be happening in the next 2 years. So it's more prudent to just kind of keep where we're at, and then we can figure out what we're going to need to do next. The next area or component is the community supports and services. This area, the changes have largely been in terms of how there's not new programs either. It's more of how we're structured the program. So we've opted to take our full service partnerships, often referred to as FSPs, which are care usually for our more acute, higher levels of care. It's the whatever it takes approach are under the full service partnerships. And we're moving those from programs from being just FSPs, and then we had like intensive outpatient, and then we've combined those into a continuum so that provider, CBO, has that whole service, and so they can move people up and down based on what the person needs. So if someone needs, when they come in, they need really intensive, high-intensity services, they'll be in the FSP with that same provider. But if they're ready to step down and transition to a lower level of care, they don't have to be sent to a new provider. Within that same provider, with the same people they're familiar with, they move down to the level of care. So it's a way for us to streamline those. There is one of the things that we have to keep in mind when we do those, though, is we do have a percentage requirement for full service partnerships. So we have to make sure that the amount of money we're spending for FSPs, full service partnerships, is always at like 51%. So while we expand those opportunities for people to get more levels of care, we do have to make sure that we're also spending money in that on the FSPs. Now, the good thing is, again, with payment reform and more opportunities, there's more services that can be covered under that. So that means that should hopefully allow us to serve more people in the FSPs with that higher level of care. Children's Continuum, so that's one of the ones that it's kind of a change. So from when we were working on this to now, we had our children's FSP, and it was just the FSP with payment reform, payment reform is basically we went from cost reimbursement to a fee-for-service model. So that really impacts programs, because if it's like, hey, we're serving 10 people and this is how much it costs to serve 10 people, it's fine. Now with the way that we've gone with payment reform is like, if you're serving 10 people, you're only getting paid for 10 people, but maybe your cost to actually operate needs to serve 40 people. Well, how do you do that? And so we've restructured these, again, to continuums as well, so they can get maybe folks that are low level of care, or as they move someone from the high intensity to a lower level of care, you're not losing that person, you're shifting their level of care, but they're still within the same organization, building capacity, giving staff still plenty of services to provide, things of that sort. So it's more, the change is basically going from an FSP to opening up to a continuum. Adult continuum of care, these ones are agreements that are also being modified from solely FSPs to continuum of cares. I have an asterisk next to that because when we posted this plan, that final move hadn't been made, and so we posted the plan. Decision has been made to make those into continuums, so that it's going through contract amendments. So we're calling it out here so that everyone is aware. They don't come and say, wait, when did you change this one? Like literally like a day after we posted, it's like, oh, we want to change this. It's like, okay. So instead of starting a whole new 30-day process, we're going to come to you guys before that and share with people some of that information. So this will be something that we're going to write into. It won't appear in the plan as like, hey, they're intending to make these 3 programs into a continuum. It'll be an addendum that we'll add, and that'll be noted. And then our children and youth justice services, we had an effort to do ACT level. So ACT stands for Assertive Community Treatment Level. It's the highest level that is not inpatient that's available. Very intense, really meant to get people, like, wrap around them, support them, stabilize them so you can keep them out of the hospital. Our structure and the different resources were that to where we were trying to do more of an act-like than an actual act, and so we didn't feel that it would be accurate for us to say we have an act team. And so what we did is we changed the name from Justice Act, which I guess it stands for Assertive Community Treatment, which is a model, on type of care, to where we renaming it to Adolescent Community Treatment Team. And we're not going to use the acronym ACT. We're going to spell it out so there's not a confusion between the two. So it's still going to be that high level intensity, but it's not doing the program to fidelity. And we didn't want it, in transparency, we're like, well, if we're not doing it to fidelity, let's not call it that, because you may watch that and see that and say like, oh, on here it says you have an ACT team, so you're doing all the things exactly the way it is. Not to that level, but close, so we're renaming that just to, again, for purposes of being accurate. I'm going to jump into innovation. Innovation is the area that is probably always in our annual updates, has the most changes because they're on different cycles. They're depending on when you get the idea, when you write the plan, when you get the project approved, you go through. They're 3 to 5 year plans. They sometimes take a year to get started. So they're not always coinciding with our 3-year plan, so there's overlap. And so this is the areas where you'll see the most movement. And in our community planning process, we did spend some time on innovation plans because that was an area that you're going to potentially see some new projects and some changes. So the Lodge, which was a program, was extended last year to a 5-year, from a 3 to 5 year with some additional funding. So that has what, Lisa, 1 year left or 2? This and then next year. Yeah. So in this plan, this is an extension year on that project. A lot of positive opportunities with that, especially with the addition of bridge housing, which kind of models on that. So we'll be looking at those in the coming years. Alcove, which is a specific model that the Mental Health Services Oversight and Accountability Commission created, which is very well structured and resourced youth drop-in center, I guess you would call it at least, that has kind of like a criteria model for it, was something that we were looking at because so much of the feedback we were hearing from youth, whether it was our sessions or we would be in other listening sessions or hearing like from students at schools, was them wanting something that was for them, by them, a peer-to-peer, a youth-to-youth. Not that they didn't want therapists and all that stuff, but they go, sometimes I don't need that. I just need someone else that I can talk to. So we thought Alcove could be that solution. Do we create a one-stop center to where they could get the peer support, they could get the therapist, they could get the nurse? As we were doing our research and looking at developing that concept paper, we were really concerned with the ability to sustain a project like that, because an Alcove model has things like a psychiatrist, nurses, therapists, all those. If anyone's been in Fresno, the Central Valley, we've been a mental health shortage and a healthcare shortage area for more than a decade. So you're doing a program that says you have to have these, and we're like, we're not sure we can find those. Would that be an issue? The other concern was, once we utilize the innovation funding, how are you going to sustain such a robust program? And then we were talking about potentially changing funding with Prop 1. How is that going to work? So Alcove, we didn't feel would be a viable solution. So even though it's in our plan, we're looking at potentially not moving forward with that. However, still listening to the youth, we do want to do something for youth, still some type of a peer-to-peer, peer support, something by youth, for youth, with youth. So still going to try to do that. We're just not going to use this specific model because of the concerns I said, the sustainability, viability, the capacity that you need for it. Our justice-involved youth research project was approved and is finally starting with the contracting process. So that one we're working with, it'll be researchers. We're going to work with our local CBOs. We're going to be working with the probation department. And it really is going to be developing an understanding of ACEs, adverse childhood experiences, for the youth. And once they have that understanding, actually talk to them and ask them, so based on that, what would have worked? What should we be doing? So we get real-time local information that can be shared with everyone in terms of better prevention programs and ways to support youth to keep them out of the justice system. So that one is finally starting. It will start doing that project before the end of this year. And that is a 3-year project after that. We have submitted to the Mental Health Services Oversight and Accountability Commission an extension to one of our existing plans, which was the California Reducing Disparities Project Evolutions. This one funded 3 community-defined evidence-based practices. The project was looking at how do we make adaptations with the stakeholders and the community to their program so it doesn't lose the integrity of their program, but it aligns better with some of our funding. Problem we had was with Prop 1 potentially passing and going on the ballot. It's like, well, we can't use PEI funds. Even without Prop 1, we're looking at our prevention early intervention funds dwindling over the next few years. That's the economic forecast from the state. So it's like, well, if you're going to have less money, how are you going to add programs? So it's kind of like, okay, well, we got to go to the drawing board. So this innovation plan is going to do two things. It's going to buy us an additional 2 years to kind of figure out what are we doing and really focus on sustainability. And so we're going to be doing technical assistance with Third Sector, an agency that we've worked with that does a lot of statewide work, to kind of assess the programs and look at where are the areas that we're not billing, where are the areas that we could actually generate revenue, what are the other funding sources that they can do to be sustainable. And that will not only benefit our 3 CRDP programs, or CDEPs as they call them, within Fresno County, but there's 32 other ones like this up and down the state, and they'll be able to go like, wait, Fresno did this assessment, this is what the programs in Fresno are doing that are allowing them to generate more revenue or be more sustainable. Hopefully it helps us have more of those culturally responsive programs through that process. So that one is to the OAC. They've sent it out for public comment. At this point, we're just waiting for them to tell us what commission date our plan would be going up for approval, but we anticipate that being approved by the end of the year. We did add some additional funding to that because we are adding 2 more years of service. And so we're funding those at nearly the current levels. There's going to be slightly some additional funding, and that's to provide that capacity for billing, reporting, the stuff that they're going to have to do. And then we added funding to that innovation plan specifically to work with Third Sector so that TA can happen and help them with that assessment. Which one am I looking at now? So on the other side, you'll see we have in bold, it says reversion. What is reversion? Reversion basically is money that you have allocated under your Mental Health Services Act. If it's not used in a certain time period, it goes back to the state. Reversion has always been there. When you're starting out and you're building and starting programs, you don't usually have an issue spending. Like that part is fine. But what we run into is there's 2 different ways that they determine reversion. One is the Department of Healthcare Services goes by whatever fiscal year that project started, that's the year your clock starts. The Mental Health Services Oversight and Accountability Commission, who approves your plan, says your clock for using those monies, whether it's the 3 years or 5 years, starts the minute you spend the first penny. So you have 2 different things. So one state agency could say, right now, if I got a plan approved, my clock started June 1 or July 1 already, even though my plan might not get approved till April 14th or March 13th. They'll go like, no, your clock started. The OAC will be like, your plan got approved today and you don't start spending till tomorrow or end of the month, that's when your clock starts. So the challenge is there's 2 different timelines they're giving you, but basically once your clock goes that 3 years or 5 years that goes by, if you've not expended those monies or they're not encumbered or utilized, they go back to the state. We're looking at potentially having some, that's gonna go great on the live stream. Some of the areas that we're potentially going to have reversion are programs and projects that are up and running and they've been doing them, but the project's not expended all the money, which is actually, I don't think counties, and that should be, I'm waiting for them to go by, penalized. That I think is, a credit to our partners, our CBOs, and counties saying, hey, this is how much it costs to do the program. We did it. There's money left over because we didn't waste it. We were, we practice responsibility with our spending. We really stay close to our budgets. If anything, I think it should be like rewarded, but we don't make that decision. So we had a project called Project Ridewell that was conceived right before the pandemic, approved in the first few months of the pandemic, and then had to sit idle for years because it was a project that was looking at leveraging transportation. We were going to partner with the EOC. We were going to pilot some rural areas and also Metro. How do you get people, almost think of like an Uber, but for like, hey, I don't need to just go see my therapist because that's an important part and there's a benefit that you can use for that, so that's covered. But what if part of my recovery plan is like, I'm a veteran and I want to go to some veteran groups? Well, how do I get there if I don't have a car, I don't have a way? And it's not I'm not coming for a medical appointment, so it's not covered. Or, I want to go to a parent group, or man, I want to start going to the library in my town so I can start checking out books and start learning about, this stuff for myself. This program was going to try to, provide additional supports, and we were going to assess and measure like, hey, when people were able to get help to get to those other things that are not part of their specific, like, mental health treatment, but they're definitely that support system. Does that improve their wellness? We had it all figured out. We were going to do this. And then with the pandemic, it was just like, well, everything's closed. All right, well, we got to wait for the program. Hey, we need to be keeping people physically apart. We cannot cram a bunch of people in cars and vans. That is not a safe thing to do. And so it's kind of like one thing after another that was delayed. And once we were like, okay, we might be able to do it now, that's at the time, if you guys remember a couple years ago, we were at the peak of fuel costs. There were no cars. There was no car parts. There was no, and then, the inflation's like, hey, this is going to cost X amount, and we only got approved for this much. In the end, and working with our partners at the EOC, it just ended up not becoming viable. And again, this was almost 4.5 years ago when the idea came about, almost 5 years ago, actually. And so at the end of it, this project is not going to be something we can get up and running because we've got, when we made this discovery, it was probably like December, so we're like, there's no way we can put a program together and responsibly spend $1.2 million on a project like that. That was supposed to be done over 3 years. So rather than really wasting our own taxpayer dollars that you and I put into, that's something we're going to tell the state. We weren't able to do it. Here are the circumstances for it. Hopefully they may say it'll come back in a cycle, or they may do something else with it. We don't know, but we feel, in transparency, that we can't responsibly spend that much money in 6 months on what it was approved for. I can spend that money, not on. We all could probably spend $1.2 million, but we need to make sure that we're spending it for what it was allocated and approved for. So the other project that is going to be a change, which is in the plan, is we're looking to sunset a project called Handle with Care Plus. It was taking the Handle with Care model, looking at how we could apply it here in Fresno, and we were piloting it with 4 schools, with Fresno Unified, the PD. We were looking at adding, working with FCSS on care coordination. We also added and developed a parent cafe curriculum that was created by Brainwise to really help parents understand how adverse childhood experiences or life experiences or traumatic experiences could impact a child. But hopefully through that exposure, not only will they learn and be able to support their child, but they may say, well, I got other kids in the home. How do I get them help? And a lot of times going through something like that, people may go like, man, you know what? I got my own stuff, man, when I was little that this kind of made me think about. And how do we help the community get better? So we were able to get, that program was also delayed for a couple years with COVID. There was no school. Then their school was only remote. Then we're not sure if they're coming back. Then they're coming back. So it was delayed. By the time we got it up and running, it started working. There were some other challenges we had with, being able to get communications and being able to get the data and things of that sort. And in the end, after like 1.5 years, I want to say, of the project, Lisa, we looked at it and we were spending a lot of money, and everyone was doing what they were supposed to do, but the number of referrals and kids, surprisingly, was just really minimal. And the number of parents that were showing up to participate in the curriculum, which was part of the test, were almost none. So if you were doing the math, you're like, hey, we're spending like $20,000, $30,000 per person, when our projection was like, oh, we're going to be spending less, just based on volume, hundreds of dollars per person. And so in the end, we had to look at, again, is this a program we continue for another 1.5 years and try to spend the money down, or do we just go like, we're not able to? A lot of factors have prevented this program from being able to do what we intended to do. We're going to go ahead and sunset, cut our losses, and that's potentially money that'll revert. And I'm trying to remember on that one, I think it was like $700,000, $600,000 left on it. So combined between the Project Ridewell and the Handle with Care money that's not spent, we're looking at about $2.5 million that could revert back. But again, while we need that money in Fresno, we also need to be responsible, and just to spend it irresponsibly, taxpayer dollars, that's your money, my money, just to say we spend it is not. And there's nothing with the partners. Everybody was doing their job. It's just we didn't have the numbers. The people were not there. We just couldn't get the projects off the ground. And so it's to no one's fault. We're finishing out the evaluations with those, and we've asked the evaluator to not look at like, hey, what was effective about the program, but can you look and figure out why it didn't go according to plan? And so they're going to try to do calls, interviews, things like that with parents, like, hey, you got the referral. What was the reason why you didn't go through? Or, hey, you got this notice, but you didn't really take advantage of it. And so maybe we can figure out in the future, next time around, what are things that we can do to be a little more effective. You'll see on the slide, Alcove, I already talked about it. In our annual update community plan process, we talked a lot about advanced PADS, we call it, Advanced Psychiatric Directive. Fresno was one of the first counties getting involved with this project about 5 years ago. We were like, yes, create, there's an advanced health directive for a person. Well, then we were going to advance the one that California has for psychiatric advanced directive. So when a person is well, they're doing well, they're stabilized, we could have them create a legal document that says, hey, if and when you fall into crisis, how do you want to be treated? Who do they call? Having something to where like EMS or, whoever it is, crisis workers can respond and be like, oh, look, this person has a pad. Oh, this is their support system. This is who to call. These are the medication. Boom, we take care of them so they don't end up in the jail. They don't end up in the hospital. They don't end up in all this other stuff because they're not able to advocate for themselves. Another project with the pandemic. We had a meeting in here, statewide meeting. People came, the consultants, the experts, a couple of counties, and literally 2 weeks later, everything's closed. And we were like, oh, well, we spent money on some waters and I think some food and travel for some folks up to then. That project was on hold for almost like 2 full years because of the pandemic. So when it started, it was a statewide project, multi-counties, everyone jumped on, and then it was, hey, let's focus on developing the infrastructure and all these things which we were involved with. And now they've wrapped that up, but 5 years and the amount of money is not enough to do everything that they wanted to do. So now the state is going to more likely approve a phase 2, which is going to be the implementation. So we were like, well, as Fresno County, if we've invested that much money in it, we don't want to walk away now. We want to we're there for the good part, which is the actual implementation. So as soon as the plans come out, that's where we're putting it now. We want to put it out there on the table for everyone to know that our intention is to try to join the state project for the phase 2, just so we see a return on our investment. We spent all that money for part 1. Well, we want to have a say in the implementation. We want to be able to give, wait, why are you guys doing that? No, Fresno doesn't like it like that. We want it like this. We want you guys to think about this. So we're going to hopefully have a plan before the year's out related to pads. Depending on what happens with Prop 1, we may put more money into it than less, just because Prop 1 is going to change how they do that. But again, also in the next couple of years, to avoid reversion too, we may say, hey, you know what, let's go higher end on this project because it'll benefit us in the long run. We'll spend down the money and it reduces risk of us having money revert to the state. And when I say money revert to the state, it's not they're doing anything wrong. That was just written into statute 20. It is what it is. It's just when you have a project and you can't do it because of a global pandemic and you just sit idle, it's like you end up running out of time to do some of those projects. There may be a couple of other projects as they wind up may have unspent portions, 10,000 here, 20,000 here. Those ones, if we can spend it down responsibly, we will relate it to that specific project. If not, those would get lumped into also money that could revert back to the state. I'm going to go to the next slide. We're almost done, I promise. Capital facilities and technology. This one we do every time we do the annual updates and 3-year plans. Our goal is to move an allowable level of CSS or unused CSS funds or unspent CSS funds, which was, if you guys remember, like 2 slides back, to this pot. So you can move any CSS monies you're not going to use that year, you can move it into this pot to use for capital facilities and technology. But capital facilities has to be like construction, rehabilitation. They have to be things that the county or whoever is doing it owns. So you can't do like, hey, we're going to do a remodel of a building that we only have a 3-year lease on. The state's concern was when they wrote it is, we don't want you to spend $13 million and then hand it over to somebody else, like 3 years later because the project didn't work out. And the property owner is like, man, I got $13 million in renovation. I don't have to pay anything for it. So that's why even with our CBOs and partners, when we're looking at those things, we're like, is it something that's like more of a permanent, right? Hey, do you own this building? No, like, I really don't want to put a new roof on it because if you change buildings, you can't take the roof with you. But if you go like, hey, we're going to put in, I don't know, an AC because it's hot and that AC is broken this summer, like, okay, we'll figure that out because worst case, you could take the AC with you. I mean, I'm just saying, it doesn't happen too often. But there's specific limitations on the fundings for these. So we existing have $18 million budget in capital facilities and technology, and this money's already kind of spoken for to go into finishing up the new campus that we'll have in Olive. It is to finish the moving of our services off the UMC campus, what we call the Metro campus, to the Heritage Center or the Old Children's. So it's updating, expanding, building out services and programs. We're doing those. Capital projects cost money. If anyone has followed anything with the economy with inflation, capital projects cost more now, supplies cost more now. So we're looking at whatever is going to be the maximum allowable of unused funds that we can, from one pot that we're allowed to put into this pot. And now I'm getting into this like too technical, which people are going to be like, what are you talking about? Email us, ask questions. there's just a lot of regulation, like you can only move from this pot, you can only move into certain things. From this pot, you cannot move money no matter what. So if we could, the innovation money I was talking about, that's going to revert, if we could, we would move that into, we can't. That money has to stay in that pot. This is one of the few projects where you can add money from another pot to it. We don't have an exact it's 18 million is budgeted. There could be more that we put into that, but we won't know that till closer to the end of the year because we'll be able to see what have we spent in this, what is still remaining, what is that percentage that we may have left that we could move money into this pot. So we're more of putting it out there for transparency that, look, if we can move more money into this area from unused CSS funds into this, we'll do that. But when we do that, you'll see that in next year's update. Like, hey, you know what? We added another $2 million for the projects. And we're also looking at moving how we're funding our electronic health record. We're funding out of this pot, and we're looking at can we fund that through some other administrative costs and free up some of that technology funding to also support with some of the capital projects. Because we just need more beds, we need more housing, we need more service centers, things like that. And so that's what we're really focused on. So public comment, see where I told you we're almost done. Public comment, you can submit public comment until March 20th. I'm going to give you an email in a second where you can email your questions, comments. The questions can be from like, great job, to like, I don't like this idea, to, questions on, can you explain this part to us? So you've got plenty of time to still provide public comment on those things. And then if you're available and interested, you can come to the public hearing on the 20th yourself. If you're not able to make it today and you have a question it's technically public comment, so it's less a Q&A. It's more of, this is my concern, or this is my support, or this is an idea. But you'll be able to come and provide that at that time as well. You don't have to do both. It is an either or, whatever's most convenient for you. As far as the outcomes and results? Yeah, oh yeah, so one of our audience members asked if there's a way for us to send out an invitation email as far as with information related to the public hearing so people can come, and absolutely, we'll actually put that together maybe by, looking at, if not today, tomorrow morning, we'll send out to the listserv that people are on, and then we'll also post it on our social media of, hey, this is the date, it'll be right here. Time, location, all the stuff. So if people want to come, by all means, we want the public to come. And if you're not able to, for some reason, as one of our audience members asked, about if you're not able to, if you use that MHSA email address, you can email us questions, comments, whatever you want. That's another way that you can submit that. And the website that I have above that Fresno MHSA, is actually the website where you can go download or review the plan that Lisa, that we were talking about, but also the sections if you want to go look at it for yourself that Lisa was mentioning. With that said, we are done with our follow-up session. I don't know if there's any comments or other questions or anything that people have, but we'll make sure to send out that invitation to everyone. That's a great suggestion. Or do we have anything on the interwebs? Any questions, comments? We'll give it like another minute just in case there's anyone struggling. And again, for folks that maybe are watching this later on and you're like, oh, I'm watching this over this weekend, anytime up to the 20th, you can submit public comments. So if you're watching this 2 days from now and you're like, oh, the info is right there, the MHSA at FresnoCountyCA.gov, send us an email. We'll include your comments or try to respond to your question, or you'll be able to, like I said, join us in person next Wednesday. And the plan is at FresnoMHSA.com. You go on there, you'll see the plan if you want to review it. And if you go, would you rewind, or I don't know how you would say with like if you go back, to the beginning of the presentation, you can also see where Lisa breaks down where everything is, but you'll see it on the table of contents as well if there's a specific area you have a question on. All right. If there's no more comments or questions coming in on the chat, on the live stream, or here in the room, we're going to go ahead and wrap this up, and hopefully we'll see from you by the 20th, and we'll get this plan done and continuing our work. All right. Thank you, everyone.